Coronavirus vaccines. Today we are going to discuss about coronavirus vaccines. As we know, there are many types of coronavirus vaccines like AstraZeneca, Pfizer, Johnson & Johnson, Moderna, Novavax. There I picked two of them, AstraZeneca and Pfizer. AstraZeneca, it has given in Ethiopia, which is my country, and so I will focus on AstraZeneca and Pfizer. It has given in USA. Till today, USA is the top of first world countries, so they choose Pfizer to give to their citizens. So I will focus on AstraZeneca and Pfizer. When we come to AstraZeneca vaccine, it is known with its code name AZD122 vaccine, and it's investigational vaccine for active immunization to prevent COVID-19 caused by SARS-CoV-2, which is severe acute respiratory syndrome, coronavirus number 2. And it's composed of recombinant replication incompetent human adenovirus type 26 vector, which expresses the SARS-CoV-2 spike, which is called S antigen, after these viruses enters the human body. Subsequently, the immune response to this S antigen protects the vaccinated person against the coronavirus. And it is given in 2 doses intramuscularly or IM, 0.5 ml each with an interval of 8 to 12 weeks. It is not recommended to those with severe allergic reaction to the vaccine components and to those younger than 18 years old. AstraZeneca vaccine has an efficacy of 63.09% against the symptomatic SARS-CoV-2 infected individuals. And the side effects of AstraZeneca vaccine includes thrombosis with thrombocytopenia syndrome or TTS, which was reported after vaccinations of the AstraZeneca vaccine type called Vaxzevria and Covishield. The rate of the occurrence of TTS is very low. It's 1 in 250,000 adult vaccinated adults. The rate in Europe was 1 in 100,000 people. The thrombosis in brain and abdomen is the key features of TTS. The symptoms can be severe headache, severe abdominal pain, or shortness of breath 4 to 20 days after AstraZeneca vaccination. On CBC analysis, we find low platelet count if TTS is there, and further radiological studies can confirm the diagnosis. If the diagnosis of TTS is solid, avoid using heparin. Instead, use non-heparin anticoagulants and immunoglobulins. Regarding pregnancy, AstraZeneca vaccines should be considered if the pregnant woman is highly exposed to SARS-CoV-2 infection or has comorbidity. It is not yet approved by FDA of America. The other anti-COVID-19 vaccine we will see in wide scope is Pfizer. Pfizer is FDA-issued vaccine for active immunization to prevent COVID-19 caused by SARS-CoV-2 in individuals with age of 16 years old and above in December 11, 2020 AD. And the mechanism of action for A Pfizer vaccine is very fascinating. The vaccine is composed of messenger RNA surrounded by oily bubble to avoid degradation of messenger RNA by the body enzymes. After vaccination, the oily bubble containing messenger RNA fuses with a given body cells. Then messenger RNA enters the cell and the cell starts to produce spike antigen which are presented on the cell surface, which would be recognized by the immune system. Then the immune system produces antibody which protect us, the vaccinated individual from COVID-19. The messenger RNA would be degraded with no remaining trace. And this vaccine has efficacy of 95%, unlike the astrazeneca. And it is given in 2 doses intramuscularly 21 days apart. Each vial of the vaccine contains 5 doses of 0.3 ml, and it should be diluted with saline, and it should be used with 6 hours after dilution. It should be used within 6 hours after dilution. And the side effects for dose 1 includes pain at injection site, headache, fatigue, muscle pain, and for dose 2, pain at injection site, fatigue, chills, fever greater than or equal to 38 degrees Celsius, muscle pain, joint pain. When we come to contraindications for using not to use, the Pfizer vaccine includes history of severe allergic reaction to the vaccine components, allergic reaction to polyethylene glycol or polysorbate. So my conclusion is that Pfizer is a way better vaccine than AstraZeneca. So take a Pfizer vaccine if you have the access instead of AstraZeneca. Thank you guys for your time. Thank you very much.